Hello, and welcome to my presentation on caring for patients with dementia. What is dementia? Dementia is not a single disease. It is an overall term. It is a group of disorders under the general term dementia caused by abnormal brain changes that triggers a decline in cognitive abilities and daily life and independent functions. Some types of dementia are Alzheimer's disease, vascular dementia, mixed dementia, Lewy body dementia, and frontotemporal dementia. Some do's and don'ts of caring for a patient with dementia. Always keep your body language friendly and positive. Don't rush their conversation. Always use open-ended questions. Allow them time to express their feelings. Don't argue and just let it go, and always show proper respect. Make eye contact. Give them extra time to speak. Provide therapeutic distractions and always speak calmly. Don't speak loudly. Don't point out their mistakes. Don't assume they remember everything, and don't refuse to assist with ADL care, and don't avoid interacting with dementia patients. My project goal and objectives are as follows. My goal was to design, implement, and evaluate an in-service for nursing staff on the care of patients with dementia. My first objective was to analyze current peer-reviewed literature regarding evidence-based practice on the care of patients with dementia. My second objective was to implement the in-service for nursing staff on caring for patients with dementia. And my third objective was to evaluate the effectiveness of the caring of dementia in service. My learning strategies. The overall goal of lesson planning is to make learning more impactful for students. My lesson plan was designed to educate and help the nursing staff within our facility to care and communicate with patients with dementia with dignity and respect. Some of my learning strategies are as follows. Write a lesson plan for the in-service with at least 3 objectives. Receive permission from the facility to trial the bedside reporting progress with the nursing staff. Hold an education, training in service about care of patients with dementia. Create a survey for the nurses to complete on satisfaction for the in-service. Analyze data from the surveys with the nurses and write a summary of the analysis, program, and findings of the entire project. Evidence of my learning strategies include an annotated bibliography of the peer review articles, a lesson plan with the 3 objectives, a roster from the in-service and the educational materials, the survey with the survey results, a summary of the survey results, and a detailed summary of my project, and an informational flyer that me and my mentor created for this project. Outcomes equal learning strategies. The peer review articles helped to improve my understanding of people living with dementia. It also educated nursing staff on dementia. The lesson plan helped me to educate and guide the nursing staff on what is dementia. And the policy and guide provided me information on how to take care of our residents with dementia within our facility. And the in-service provided education and training on communicating with patients with dementia. And the survey provided me with feedback on the information that was presented to the nursing staff. I would take what I learned in my project and apply it to my practice by appropriately communicating with dementia patients. How to direct dementia patients with aggressive behavior, how to provide ADL care to patients with dementia, and the caregiver's perspective of living with patients with dementia, and most importantly, how to approach a patient with dementia. In nursing practice, we should allow patients with dementia to do as much as possible with the least amount of assistance and provide choices with simple instructions. I chose this topic of caring for patients with dementia because my dad was diagnosed with vascular dementia a few months before he passed away. I literally saw him decline before my eyes, and I was not recognizable to him a week before he died. It was then that I finally realized that any type of dementia makes a person fragile and special, and they need to be handled with care. So the value of the project to my lifelong learning experience is that this project taught me people living with dementia don't have control of their feelings or actions, and we should always care and support them to help manage their quality of life and help slow the decline in their mental cognitive abilities. Thank you for taking the time to watch my video presentation on caring for patients with dementia. Have a good day.